So one of the ways that we and many other places have tried to get the biggest bang for the heart failure buck is to try to expand from the traditional one-on-one, one doctor, one patient relationship in order to be dealing with it. And this is certainly, there's no way that we can deliver care to close to 6 million people with that sort of traditional model. So we are using a variety of alternate ways, shall we say, than this one-on-one doctor-patient encounter. We are making a lot of use over our expanded providers, so nurse practitioners. In our program, we're fortunate we have a pharmacist that is, not only assists, but really spearheads our medication up titration clinic. And it's been shown at other institutions in the literature that pharmacists can do a terrific job. In fact, probably one of the best jobs of adequate up titration of the appropriate heart failure medications for those patients. So in addition to that, we increasingly use telephone encounters, telephone visits. It becomes a little challenging on the reimbursement side, but it's still, compared with a patient being admitted to the hospital or coming to the emergency department with decompensated heart failure, it is a very, very helpful adjunct. And so at telephone, we do some telemedicine consults with devices so we can see that are a little bit souped up from Skype kind of devices, though it certainly can help. For the physical exam, for the assessment for the heart failure patient, really the most important component of that physical exam from a heart failure standpoint is to look at their jugular venous pressure. That we have still found challenging to look at. We do it. I wouldn't bet my career on measuring that jugular venous pressure on a patient with telemedicine. So hopefully our technology will continue to improve. Then the other type of telemedicine visit is with the use of implantable monitors. So some of them are available as an accessory to, say, a pacemaker or defibrillator or biventricular pacer. But we now also have a device that is implanted in the pulmonary artery, the CardioMEMS pulmonary artery monitor pressure, which gives us information with regards to the pulmonary artery systolic and diastolic pressure that really can help manage very complicated patients. It's a relatively expensive proposition, but if it can prevent a couple of hospitalizations, then it makes a lot of sense.